There's going to be a lot of issues coming out of what's happened in the last week, but one of them is going to be that chains of transmission will have become lit from these gatherings. And Minnesota, one of the hard-hit states by the protests where you've seen large mass gatherings, that state has been seeing an uptick in cases to begin with. Even before these protests started, we saw rising hospitalizations in that state. So this country isn't through this epidemic. This is continuing to expand, but at a much slower rate. But it's still expanding, and we still have pockets of spread in communities that aren't under good control.
If you were out protesting last night, you probably need to go get a COVID test this week, because there's still a pandemic in America that's killing Black and brown people at higher numbers.
The mayor of Atlanta, and before that, former FDA Commissioner Scott Gottlieb on the potentially deadly consequences of large protests during the coronavirus pandemic. Joining us now, Morning Joe Chief Medical Correspondent Dr. Dave Campbell. Dr. Dave, I'm sure we weren't the only ones thinking this, watching this all unfold, and these people, you know, very close to each other, some of them obviously scuffling and having physical interactions. How possible is it that there will be a few, if not more, coronavirus cases out of these protests that turned into riots?
Yeah, you're right. Everybody across the country was watching this unfold with the same question in their mind. And all the experts so far that I've interacted with do believe that we will see a spike. And it will be in areas across the country, not just Minneapolis, but we'll see areas that are already showing hotspots, like in the South and the West, that will show some increase in the numbers of cases over the next few weeks. Maybe by July 4th, and thereafter, we'll start seeing increasing deaths. It's important to remember that there is a difference between being inside and outside, and there's a great difference between having a face covering on or not having a face covering on. So the little bit of good news, Mika, would be that the protests are outside. But I wouldn't take that example too far, because many closely quartered individuals are going to spread aerosols and droplets. And we already know that talking spreads this droplet by about 6 feet, coughing by about 12 feet, sneezing by about 18 feet. And I don't know anybody that's looked at screaming and chanting how far that will send the viral particles, whether they're aerosolized or by droplet.
Yeah, you know, Eddie Glaude, how concerned were you during these protests, watching these protests over the past several days, by the fact that it is Black and brown Americans who have felt the disproportionate impact of COVID-19, and probably a majority of the protesters that we have seen have been Black Americans.
Yeah, my own son participated in a protest yesterday in Trenton, New Jersey, and we had to have a hard conversation, difficult conversation about social distancing and the threat of COVID-19. But, you know, just like the economy, trying to, folks forcing the economy open, forcing people to make a choice between being able to provide for their livelihood and the risk of death. You have folks making the choice that they have to protest brutality, police brutality, and risking their own lives again. At the end of the day, Joe, I look at it like this. In 1968, after the uprisings, America made a choice to double down on its ugliness and turned its back on the possibilities that the Black freedom struggle opened up. 2020, we have to make a choice. We're on a knife's edge. Will we double down on the ugliness, or will we finally transform and become a truly multiracial, just America? That's our choice right now.
So, Dr. Dave, given these protests are in all 50 states, often multiple cities in each state, what are we looking at? What is the data telling you about a second wave? And will these events perhaps step that up?
We should look to July 4th. We know that on Memorial Day, a lot of states opened up. In fact, all 50 states now have some degree of opening up, and all 50 states also have had coronavirus cases, COVID-19. So if we look at the calendar and realize that a few weeks, once you're inoculated, to be infected and get sick, and then a few more weeks for those that are going to go in the hospital, and then a few more weeks for those that will unfortunately die. We're looking at July when we could start seeing some dramatic spikes, although even in a couple weeks in some of the very hot spots where the protests have been protesters densely congregated, we could see it even sooner, according to the experts.
All right, Dr. Dave Campbell, thank you
you.
so much. And thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.